Chronic obstructive pulmonary disease is a progressive lung condition characterized by airflow limitation, breathlessness, and reduced exercise tolerance. Physiotherapy plays a crucial role in managing chronic obstructive pulmonary disease by improving respiratory function, enhancing physical capacity, and optimizing quality of life. Physiotherapy techniques used in the treatment of chronic obstructive pulmonary disease include 1. Breathing exercises. 2. Airway clearance techniques. 3. Pulmonary rehabilitation. 4. Inspiratory muscle training. 6. Positioning for breathlessness. Breathing exercises form a fundamental component of chronic obstructive pulmonary disease management, with several specific techniques showing beneficial effects. The core breathing techniques include pursed lip breathing and diaphragmatic breathing, which are typically practiced for 5 to 10 minutes under supervision. To enhance the effectiveness of breathing exercises, they are often combined with flexibility and chest mobilizing exercises. These include pectoralis stretching, shoulder stretching, and lateral trunk stretching, typically performed 5 times each. Additional specific techniques include breathing in different portions of the lungs, self-massage of intercostal muscles, and exercises combining forced exhalation with gymnastic movements for chest, abdominal, and back muscles. When integrated into rehabilitation programs, these exercises are typically conducted over a minimum of 8 weeks or 20 sessions, with 2 to 5 sessions per week. The airway clearance techniques include postural drainage, percussion, vibrations, and assisted coughing techniques. These are commonly used to help remove excess airway secretions, which is particularly important as chronic obstructive pulmonary disease patients often experience mucus hypersecretion and impaired mucociliary clearance. Active cycle of breathing technique combines breathing exercises with postural drainage and has shown significant improvements when combined with other treatments. Additionally, device-based interventions use several mechanical devices are used for airway clearance, including 1. Oscillatory positive expiratory pressure devices. 2. High-frequency chest wall oscillation. 3. Intrapulmonary percussive ventilation. 4. Intermittent positive pressure breathing. 5. Temporary positive expiratory pressure. Studies have shown that both intrapulmonary percussive ventilation and high-frequency chest wall oscillation can improve daily life activities and lung function in severe chronic obstructive pulmonary disease patients. Intrapulmonary percussive ventilation has demonstrated particular effectiveness in improving small bronchial airway obstruction, respiratory muscle strength, and health status, while also reducing sputum inflammatory cells compared to high-frequency chest wall oscillation. Pulmonary rehabilitation encompasses a broad range of interventions designed to optimize physical and psychological functioning in chronic obstructive pulmonary disease patients. The core components of pulmonary rehabilitation are focused on exercise training, which includes both endurance and strength training, typically conducted 3 to 5 times per week for 20 to 60 minutes over 6 to 8 weeks. Exercise sessions should be supervised by a physiotherapist at least twice weekly, with additional sessions performed either at home or in community rehabilitation centers. The program incorporates peripheral muscle strengthening, particularly focusing on lower limbs, using resistance training at 70% of maximum capacity, along with progressive endurance training that begins with 15-minute sessions and gradually increases to 45 minutes. The intensity is carefully monitored and adjusted based on individual patient responses and perceived exertion levels. Beyond exercise, pulmonary rehabilitation includes comprehensive patient education and self-management training. These educational components cover essential topics such as disease knowledge, smoking cessation, medication management, breathing techniques, and strategies for daily activities. Additional support services may include psychological counseling, nutritional advice, occupational therapy, and social support, all tailored to individual patient needs. Patient education is particularly emphasized as a crucial component, addressing the common challenge of treatment compliance and helping maintain the benefits achieved through exercise training. This comprehensive approach has demonstrated significant improvements in health-related quality of life, often surpassing the benefits achieved through pharmacological treatment alone. Inspiratory muscle training has emerged as a vital component of pulmonary rehabilitation programs for chronic obstructive pulmonary disease patients, focusing specifically on strengthening the breathing muscles. The implementation of inspiratory muscle training follows structured protocols, where training loads are set based on a percentage of the patient's maximal inspiratory pressure, typically ranging from 30 to 80%. These loads are regularly adjusted every 1 to 2 weeks to ensure progressive training. Studies have consistently shown that inspiratory muscle training improves several key outcomes, including inspiratory muscle strength, exercise capacity, and overall quality of life, while reducing dyspnea symptoms. When combined with other respiratory techniques, such as bronchial clearance methods, inspiratory muscle training has demonstrated effectiveness in increasing inspiratory muscle strength, regardless of whether traditional or modern approaches are used. This versatility makes it a valuable addition to comprehensive chronic obstructive pulmonary disease management strategies, particularly when integrated with broader pulmonary rehabilitation programs.